Welcome to Managing MDS. My name is Doug Smith. I'm a professor of oncology at the Sidney Kimmel Comprehensive Cancer Center at Johns Hopkins. When speaking about MDS, I'm commonly asked the question of what is the role of TP or P53 mutations in patients with myelodysplastic syndrome? Well, I'll take a step back and say that our understanding of myelodysplastic syndromes has really grown in the last several years. We now understand that there are numerous molecular mutations that are incredibly important for outcome and prognostication in patients with myelodysplastic syndrome. Now, P53 or tumor protein 53 is really a tumor suppressor protein. And what's important to understand about it is when it's mutated, patients are at higher risk of developing mutations. This protein, this gene is located on chromosome 17. And we've found in looking at large studies of patients and looking back at their tumors, that those patients with P53 mutations, specifically MDS patients with P53 mutations, tend to have a worse outcome. Not only do they not respond as well to traditional therapies as to those patients who have wild type P53, but they also have a higher risk of transforming to acute myeloid leukemia. So as we move into the molecular era, I think it's important to understand molecular mutations and how they portend outcome for patients with MDS. P53 is a mutated P53 is a poor outcome predictor for patients with MDS. I'm also asked questions about other mutations in general. Are there other molecular mutations that are very important in myelodysplastic syndrome? And again, the advances that we've seen in MDS and understanding the biology of MDS are really incredible. But there's a handful of molecular of genes that are mutated, molecular markers that offer us prognostic information in myelodysplastic syndrome. I'll name a couple of them. P53, which I just mentioned, again, tumor protein P53, tumor suppressor, poor risk outcomes. A gene called ASXL1, AXL1, again, is one of the markers that offers some prognostic information, poor outcome. RUNX1 or RUNX1, also mutations, very important. ETV6, poor prognosis associated with that mutation. EZH2 is another one. And I've mentioned this group specifically together because there's been a very nice publication in the last few years that suggests that these markers together can form a panel. And depending on which ones of these are mutated, some very important prognostic information could be gathered, and we could start to divide patients into those with certain molecular mutations or a molecular panel, and those that don't have those molecular mutations. The last comment I'll make about molecular mutations that are most exciting for me as a person who's interested in treatments for patients with myelodysplastic syndromes is a lot of these molecular mutations are potentially targetable by new drugs. So keep your eyes and ears open for targeted therapies, new drugs coming down the line that are specifically targeting these mutations to try to improve outcomes for patients with MDS.